Hello everyone, thanks for an overwhelming response to the previous video on the review of the general surgery paper for the January session of 2017. As you all have asked for, I'll be taking this up further and I'll be in this subsequent video, I'll be discussing the short subjects and I'll be giving you an ultra important list of topics that should not be missed just prior to the May session of the exam. So the first subject that I'll take up is forensic medicine. The first topic, and if you've seen my previous videos, you must be knowing that the most crucial area of forensic that is very often asked in exams is sexual offenses. These sexual offenses the two type of questions that are most commonly asked are related to the sections, that is the IPC, CRPC and Indian Evidence Act, related to sexual offenses and otherwise as well. And specifically for sexual offenses, the specific punishments that are there for specific offenses, all these you should be knowing very well. The third thing is the three different topics: divorce, impotence and sterility. All these three are again oft repeated topics. You should be knowing them in and out. Specifically, if I talk about divorce, you should be knowing the specific conditions in which it's legal to get a divorce. Next is the topic of fingerprinting. Again, very commonly repeated. You should know the types of fingerprints, fingerprints there are, and the minimum requirement of fingerprints from a medico-legal sample. Then there is a topic of firearms. Firearms is again a very commonly repeated topic. The thing about firearms that you should all know are the various types of firearms. That is the shotgun types and the rifled firearms. So you need to know about the type of firearms, you need to know about gunpowder, the various types of gunpowder and their constituents. You need to know about entry and exit wounds and how to differentiate between them. You need to know about the distance from which a particular firearm wound is created, just by how do you calculate the distance based on the wound that is created. The medico-legal significance of biting, the importance of bite marks and the way how you preserve bite marks. Related to poisoning, particularly last session they have asked about organophosphates. They can also ask about arsenic and datura. You should know them very well. PM changes, again a very important topic, specifically PM lividity and all its synonyms, the changes that occur, you have to know them in out. The next subject is radiodiagnosis, radiotherapy and nuclear medicine. It's very important to know the bone pain palliation agents, both and the various techniques available in radiotherapy for bone pain palliation. The role of radiotherapy in CA cervix. When you'll be doing obsgyne, you'll be studying CA cervix. So there you have to study the role of radiotherapy in a bit detail. Importance of sarcoidosis and the diagnosis of sarcoidosis by the various imaging techniques that are available. The specific findings of ADPKD, that is adult polycystic kidney disease, dominant polycystic kidney disease. You have to know the findings on various examination. Ultrasound is an topic that is increasingly being asked these days, and the basics of ultrasound are asked. What are the basic principle of ultrasound and the various physical parameters of ultrasound, the various physics related parameters of ultrasound. The next is the list of contrast agents, the ionic and the non-ionic contrast agents. You should know them, as well as the side effect of these contrast agents. Role of imaging in the diagnosis of multiple sclerosis, again a very important topic. The specific signs are to be remembered. The various sites where physiologic intracranial calcification occurs, there is a list of sites and that list has to be remembered. This list can be asked verbatim in a PGI exam. Next is the list of ring enhancing lesions, again a very important list to be remembered. The role of FDG PET, last session there was no question from nuclear medicine, so high probability of getting a question from there. You have to know just the basics of FDG PET, the basics of FDG and then the basics of PET, the role of annihilation, the role of positron emission. some specific half-lives of agents, that is 99m technetium, iodine and its isotopes 131, 125, 123, and FDG because it is the most common PET agent available. Remember these half-lives. The role of DTP and DMSA while doing renal, when reading about the renal system, you must have encountered DTP and DMSA scans. So the specific situations in which these scans are performed and the kind of information they give. Then very briefly just read about what is the photoelectric effect and what is Compton scattering. You all must have gone through the basics of this, but just remember the basic principles of photoelectric effect and Compton scattering. A question might be there from this section. Next in lot is anesthesia. The basic preparation that is required for anesthesia, the patients, the medications that are supposed to be given a day prior to anesthesia, the medicines that are to be withheld, the drugs. Next is how do seizures affect anesthesia, the particular anesthetic drugs that can provoke seizures, the particular anesthetic drugs that should be given when a patient is prone for seizures. So basically drugs increasing the risk of seizures and drugs reducing the risk of seizures. Epidural versus spinal anesthesia. Questions have been asked on both these topics. You should know them very well. The role of sacral anesthesia and total intravenous anesthesia. Inhalational drugs that are given in various situations. Special situations, the role of anesthesia in special situations where you encounter patients with hypertension, with COPD, bronchial asthma, cardiac patients, obesity and full stomach, patients with epilepsy. What kind of drugs should you avoid and what kind of drugs are preferred in these special category of patients? Next is the drugs that are stored in liquid and gaseous storage forms. What is the pin system for ensuring that the correct cylinder gets attached to the correct port in an anesthesia machine? The role of xenon. Xenon is a very important topic. Please do it by heart and please read xenon in detail. There is very high probability of getting a question on xenon again. Next we come to psychiatry. Psychiatry, very important topic, the various types of personality and the various type of clusters they fall into, the role of defense mechanisms and specific defense mechanisms in specific disorders, like the defense mechanism encountered in OCD. So you have to know about the defense mechanisms in detail, the types of brain stimulation and the places and the specific clinical situations where they are of they play an important role. Again, read in detail about depression, the various types of depression and Beck's triad. This was a question in the previous session, might as well be asked in the upcoming one. Read in detail about depression. Again, the role of SSRIs and related drugs, both are equally important, and last time there was a question on mirtazapine. There is a very high probability of getting question from SSRI and its related drugs. Next important topic is schizophrenia. Again, read in detail. You all must be anyways well read regarding schizophrenia, so just keep this topic in mind. Next is the very important topic of alcohol dependence, alcohol withdrawal. What are the signs and symptoms of alcohol withdrawal and how do you treat alcohol withdrawal? Next in line is dermatology. Dermatology, there are two topics, very small topics, can be easily covered in a very less amount of time, are nails and hairs, the conditions that affect these two, and questions are asked very frequently from this. Internal malignancy markers, this is something that cannot be overemphasized, as I have discussed in my previous videos. This is a 5-star topic. You should know this list very well, and this has very high probability of getting repeated. Cutaneous markers of internal malignancy. Next in line is again acantholysis. This is a oft repeated topics, the various conditions where you see acantholysis. In continuation with this, the difference, how do you differentiate between pemphigus vulgaris and bullous pemphigoid? You should remember both their features separately and how do you compare and contrast with them. Leprosy is again a very important topic, both the types of leprosy, the reactions of leprosy as well as its treatment. The tuberculids, again very important, you should know. Next, the subject is orthopedics. Orthopedics in PGI, foot is a very hot favorite and you should know this very well. Questions can be asked anywhere from this. So if you have time, read the section on foot in a bit detail. CTVV is a very important topic. There was a question on atypical CTV a couple of sessions back. So while you're reading CTV, just have a brief outlook of atypical CTEV as well. Then AVN of whichever site, avascular necrosis of whichever site is important. Question on Pott's spine. There was a question in the last session, might as well be repeated. do read port spine, the clinical findings, the stages of port spine and its management. The ligaments of knee, both pertaining to anatomy, this can be a question in anatomy as well, and the various ligament injuries, and how do you test for those ligament injuries, and what are the specific signs associated with injuries of knee ligaments. Then there is a role of metabolism of calcium and phosphate and the various conditions in which you have varying levels of PTH, calcium and phosphate. So the various conditions in which you can have a permutation combination of elevation or reduction of these levels. So you should know them. Next is the giant cell tumor. This was a question in the last session, might as well be repeated. Question on osteosarcoma is quite expected, as well as on Ewing sarcoma. Fracture, if you talk about, the three most important ones are humerus, femur and clavicle. Clavicle hasn't been seen for a little while, so you can expect a question on this. Humerus and femur are again very important topics. Nerve injuries, peripheral nerve injuries that are involved both either in trauma secondary to a fracture. So nerve injuries you should know, the signs associated with nerve injuries you should know. Then emergency orthopedics related to trauma, fat embolism, these are the conditions which you should know. You should study them in a bit detail. This was all about the various short subjects that we should know about before appearing for the next exam, and I hope this shall help you in your adequate coverage of the short subjects. So if you did like this video, do like and share with your friends, and in case of any feedback, do let me know. Thank you.